Well, May is Mental Health Awareness Month.
Dr. Karin Ryan is a psychologist with Nystrom and Associates. She thought this would be a really great time for us to talk about a mental health diagnosis that is often misunderstood.
And last week we talked about bipolar disorder, and today, Dr. Ryan, we're going to be talking about ADHD. Nice to see you.
We're talking about ADHD, we talk about hyperactivity. We think the Gophers maybe would qualify for a diagnosis because they're a little bit like all over the place. But you know, again, just like we talked about with bipolar, ADHD I think is something that people throw around a lot. Like you might not have a diagnosis, but you sort of say, "Oh, I'm ADHD today," or
miss something. Oh, I'm so ADHD. Kind of use it flippantly.
Okay, so how do you? I mean, how do you feel about that? Is that a little bit tricky?
Yeah, I think it can be tricky because sometimes it underestimates or kind of just invalidates how difficult it can be, and then it can make it feel people have a hard time kind of knowing when it is something that they need to address and when is it really something that I want to look at and get some support for.
Okay, this is good stuff. So what is ADHD? When we like really, you know, it's not just not being able to focus.
ADHD is Attention-Deficit Hyperactivity Disorder, right? And it's characterized by a pattern of behaviors that are inattentive or hyperactive, right? And at a point where it really impacts your functioning. And so when we talk about inattentiveness, what is that? Well, that's like carelessness or making little mistakes on projects, right? Forgetting some details.
Oh, frustrating.
It's difficulty sustaining attention, right? I want to listen to you and pay attention, but I can't. It's starting projects and having difficulty finishing and kind of jumping from one to the next. It's oftentimes like losing items that you need on a regular basis. So for a kid, it's a pencil in school, keeps losing their pencil. Or for the adult, it's where did I put my cell phone? Where are my keys? That disorganization. And then it can also be, again, that difficulty doing tasks that require a longer concentration. So you'll find that you avoid it, right? Because it's difficult, so you don't really notice it, but you'll avoid those bigger projects. So that's inattentiveness.
Okay.
Right?
Okay.
And it's probably hard too, because if you feel like you have some of those, where's the line where you go, okay, I can't find things a lot? Well, that doesn't mean you necessarily have it. I mean, what do you look for when you're going in for all those symptoms? Because it's not just one item, one thing.
No, great question. And so it's, for kids, it's 6 or more. And then for adults, it's 5 or more. And it's really that pattern of it, and that it's really negatively impacting your functioning.
Okay, so then what's the hyperactivity and the impulsivity piece of this?
So hyperactivity is, you think of somebody who is always kind of moving. Their hands are always moving, their feet are tapping, kind of wiggling in their seat. It's somebody who has difficulty sitting still. They kind of pop out of their chair a lot. You think about kids, it's they might make everything a playground. They're running and jumping on things. But for an adult, it's somebody who's always on the go or restless. We also will see interrupting, so kind of blurting out answers, wanting to listen to that person, but kind of interrupting because they get distracted by something. And then sometimes just difficulty kind of waiting your turn. And so kids, it's difficulty waiting their turn in line or in the class. For adults, it might be in the grocery store or traffic. And so there's 3 types of ADHD. Okay, and so it's predominantly inattentive, so that's when you have some of that list of inattentive symptoms, but not hyperactivity. Then there's predominantly hyperactive, where you have the hyperactive symptoms, but not inattentive. And then there's the combined type, which is the most common, where you have meet the list
from
of
each
both.
list.
Yep, exactly.
Okay, that's interesting. I was wondering about that. Which one? I feel like this has to be so frustrating for people, and it's got to be such a confidence, like, you know, just messes with your mind because you think, why can't I do these little things?
100%. And then their loved ones too is like, why is this so difficult? Because it is. Right? Because it's so difficult to discern and make that decision on like, what's the most important thing? Because we know that there are differences in the neurobiology in the brain for individuals who have ADHD and don't, so it's not their fault. It's not like they're choosing this. It just sincerely is difficult to keep things organized and go from one task to the next.
Yeah, that's tough.
But then how does somebody go about, let's say, okay, so how do I test for this? I mean, how do you make it as easy as possible to go, okay, now I feel better, I have a diagnosis?
Yeah, and I think we've done such a better job at recognizing it. We used to, you know, we used to have boys diagnosed at twice the rate as girls because boys tend, right, to be more of the hyperactive type, so the kind that we can visibly see. But for girls, it was more of that inattentive, and then it would display in more self-esteem issues, social anxiety, because they're aware that their brain is operating a little differently. Not worse, but different.
And the girls probably try to cover it up.
100%.
Yeah.
And so testing, there are specific tests that psychologists can do that help discern, is this or is it not? And so sometimes it's really helpful having that objective information, test designed specifically to a test for that inattentiveness.
Well, I love, we're running out of time, but I do want to make sure to mention that the treatment can involve both medications and therapy.
Yeah.
Do you feel that both of them play a really important role? Because I think that's also where we get sort of a bad rap of, oh, we're just going to put you on a drug and then call it a day.
Yeah, because it's neurobiological, that's why those meds are so helpful for 70 to 80%, but absolutely therapy is helpful as well, one or the other. And so it's having a conversation with your provider about what's the best fit for you, for your family, but then certainly that behavioral therapy, because if a parent can learn, okay, they're not choosing this, if I say, go and get ready for school, that kid's gonna be all over. But if I say, go get your socks on.
Yeah.
Okay, now put your jacket on. And it's recognizing we're working together on this.
Yeah.
There's so many skills that can be used in therapy too to help.
This is such good stuff. Thanks,
Yeah,
Dr. Ryan.
my pleasure.
We love seeing you. Nystrom and Associates provides care in the field of psychiatry, psychology, family therapy, and more. And they have 20 locations in the Twin Cities, so super accessible. And they're happy to work with couples, families, and people of all ages.
And if you're struggling with stress, anxiety, depression, or addiction, you can reach out to them and they'd be happy to help.
That is very true.
Yeah, well, up next.